Next, you're going to assess the skin. The skin should be free of any rashes, bruising, or edema. It should be supple and have good turgor. Some normal skin alterations you might see are a Mongolian spot, which is a bluish area on the lower back or the buttocks. You see that with infants of Hispanic descent. You could see what's called a macular stain, which is a capillary malformation. You can see those on the eyelids or between the eyes, or possibly on the nape of the neck. They're commonly referred to as stork bites. They generally fade by 1 to 2 years. You could see a spider nevus, which is a benign lesion with branching vessels coming from the center, and it'll blanch with pressure. That's also normal. One abnormal finding that you could see is jaundice, which is due to the infant's immature liver and its inability to clear bilirubin from the bloodstream, and that is toxic to the infant's brain. That needs to be referred to the physician. Next, you're going to assess the head and neck. You're looking for size, shape, and symmetry. You're looking at the posterior fontanelle, which is going to be at the back of the infant's head. That should be closed by about 3 months, and then the anterior fontanelle should be closed between 9 and 18 months. Those should be flat. If they're bulging, that could indicate increased pressure. And if they're sunken, that could indicate dehydration. The sutures, you should be able to feel them clearly. You're assessing to make sure that they're not closed prematurely. For facial symmetry, you're looking for Bell's palsy and making sure that the neck has full range of motion. If it does not, that could indicate meningeal irritation. The infant should be able to hold his head up by the age of 4 months, and you're going to go ahead and auscultate over the infant's clavicles. You're listening for crepitus that could indicate a birth trauma. Next, you're going to assess the eyes. You're looking for asymmetry in slanting or spacing, and that could indicate a fetal alcohol syndrome or chromosomal defect. You're looking to make sure that the pupils are equal and reactive. You're going to do that by shining the light and making sure that they react and they accommodate. Next, you're going to elicit the red reflex. You're going to do that using your ophthalmoscope. You're going to basically shine a light in the infant's eyes from about 15 to 26 inches, and you should see a red color reflecting. If you cannot elicit the red reflex, that indicates a cataract or neuroblastoma. That needs to be the physician needs to be notified of that also, and it's normal for the infant to be sensitive to light and have limited range of vision for about the first 3 months.